Hi, Miss Stone. My name is Elizabeth, and I will be your student nurse today. I wanted to take some time to explain acute kidney injury, or AKI, a little bit better to you. Your kidneys work to filter the blood, balance fluids, and help control blood pressure in your body. When this function suddenly declines, this is known as AKI. AKI happens in 4 phases, so I'll go into each of these a little bit better. The first phase is known as the initiation phase. This is the beginning, so typically we see some type of harm to your kidneys here. This can be related to blood flow, medications, or an infection. You might not be necessarily experiencing symptoms yet, but damage is starting. This is typically the best place to catch early damage and start treatment before things get worse. The second phase is the oliguric phase. During this point, your kidneys aren't making enough urine. It can be less than a cup or 2 a day. That's a sign that they're struggling to function. Additionally, waste will start building up in your body, and you're going to be holding on to too much water and salt. Oftentimes during this phase, you might feel cognitive changes, like feeling confused, and there's also something known as uremic frost, which is basically a cast that can develop on your skin due to that due to that waste retention. The third phase is the diuresis phase. At this point, urine output will increase again. However, your body is going to be losing too much salt and water too quickly, while other electrolytes like potassium and phosphate will be retained in the body. Kidney function may be restored at this point, but urine concentration will not be able to occur. Blood tests will likely show still high levels of waste, but your kidneys are trying to heal at this point. And then lastly, the recovery phase. This phase typically takes 3 to 12 months. And again, blood tests will still be showing function of kidney not normal over this time, but eventually will normalize towards the end of that 1-year mark. For some people, the kidneys are able to make a full recovery, but for others, there may be some life-lasting damages. With that being said, it's super important to follow up with appointments and then implementing kidney-friendly habits that you discuss with your provider. If you have any other questions, let me know. I'll be more than happy to assist. Thanks so much.